If you have any chronic illness, you've probably been advised to reduce inflammation. But things like changing your entire lifestyle, overhauling your diet are simply not accessible nor easy. What is easy and not vague advice is to use nasal hygiene practices to reduce inflammation directly in that area that is your first line of defense against pollutants, viruses, and infection. Nasal hygiene is an ancient custom that is backed by science. And today I'm going to talk about how you can reduce inflammation in your body with some simple techniques and simple strategies that are not only backed by tradition and science, but boosted by medical research. So let's get started. If you're new here, I'm Dr. Zeest Khan. I'm a licensed and board certified physician. I have long COVID and my life has been completely altered by it. I have a lot of hyperallergic symptoms since falling ill, and I want to prevent any reinfection. Most infections enter the body through our respiratory tract. Typically, that's our nose. That's why it's so helpful to wear a mask as a physical barrier between you and the pathogen. But it's also really helpful to strengthen the body's natural defenses. One is an epithelial cell membrane in the nasal cavities that separates the outside world from what comes into your body. The second are cilia. These are little hair-like structures that run all along your respiratory tract. They're not the same as nose hairs, and their job is to sweep mucus and other pollutants that get attached to that mucus away from that cell membrane so that they don't even have a chance of getting in. We need to make sure that both of those defense mechanisms are as strong as they can be. So in front of me, I have a bunch of bottles of different tools that I use in my nasal hygiene routine, and I'm going to go through each one of them. The first is saline. Saline is the sleeper hit of your drugstore. It is inexpensive, accessible, and quite safe. The way that saline works is that it lubricates that cell membrane, preventing any irritation or damage. It can help reduce any swelling that's occurring, either from allergies or an infection, and it thins the mucus, so those cilia can do their job even better. Saline comes in a few different types of packaging. The one I have here is a squeeze bottle. You can also get saline in packaging that I really like. I like this brand and design by Arm & Hammer. It has a long nozzle that can reach up pretty far in your nose and a button that gives a nice continuous stream of mist. It's at pretty low pressure. The other way to do it is to make your own saline. Saline comes in packets that you can mix with purified water or distilled water, and use that in either a squeeze bottle of your own or in what's called a neti pot. Neti pot refers to the general idea of saline irrigation. That is putting saline up one side of your nose and using gravity or pressure to tip it out the other side of your nose. So it goes in one side and comes out the other. And with it flushes out a whole lot of gnarly stuff sometimes. It can be a little bit challenging to get the hang of it, but once you do, it's so satisfying to see what gets out of your body. Neti pot might not be for everybody, but don't worry. You can still get a lot of benefit from just a few pumps or squeezes of nasal saline in your nose a few times a day. The idea is to clear out whatever irritants are there so that they don't contact or don't spend a lot of time contacting that cell membrane. Now let's talk about another over-the-counter find. It's oxymetazoline. Oxymetazoline is the active ingredient in a medication called Afrin. This is a vasoconstrictor. And we talked about vasoconstrictors in my last episode about how to manage an upper respiratory infection. The active ingredient in Sudafed is pseudoephedrine, which is a systemic vasoconstrictor. I'm making a quick correction. I mispronounced Afrin's active ingredient. It's actually oxymetazoline. This isn't a big deal, but it's a pet peeve of mine. I had a brain fog moment and mispronounced a medication that I've used for many years. Anyway, let's continue. What happens when you have inflammation in the nasal passages is that cell membrane becomes swollen and the blood vessels become dilated to get all of the fighting cells where they need to be. The problem is they can become so dilated that it inhibits the flow of air and makes things more congested. The issue is that pseudoephedrine or Sudafed, those systemic vasoconstrictors, are not for everybody. They can impact your heart rate and your blood pressure. So there's a lot of people who cannot take pseudoephedrine. Oxymetazoline is not our favorite drug in the medical world, but it can be a really powerful tool when used judiciously. So by using it in the nose, you reduce the systemic uptake, which means it's not going to affect your blood pressure or heart rate as much. I use oxymetazoline in a really specific way because this medication, the way that you find it at the drugstore, is really potent. It's kind of stronger than it needs to be. You can still get benefit from this when it's diluted. So I'm going to tell you about ways to dilute this, and then I'm going to describe the way that I use it in my nasal hygiene routine. I start with a squeeze bottle of oxymetazoline. These are the old school squeezers that have a nozzle that can be removed. I take a Kleenex and simply pop off the top, and it comes out like this with a straw. What you're going to notice when you take off the nozzle of the Afrin or the oxymetazoline is that it's kind of empty. It's about 2/3 full. That's because the squeeze bottle needs air inside of it to actually squeeze and let that straw do its work to get that spray. So what I do is after I take off the lid, I fill it all the way up with saline. You can use pre-made saline or you can make it yourself. I fill it all the way to the top of the bottle, mix it around, and then I spill some out so that the bottle is once again 2/3 full. If you want an even more diluted solution, you can repeat this process and add saline back up. The idea is then to have and use just the amount that you need to open up those nasal passages. This only lasts for about 30 days, then you need to toss it. I want to point out why we dilute this. Not only is it potent medication, but you're going to find on the back label of every bottle, it says that this medicine should not be used for more than 3 days in a row. And that's because this vasoconstrictor effect can actually damage your nasal cavities and it can cause rebound congestion after you stop using it when you've used it for a long time. So I like to use with any medication I like to use the lowest amount possible for the least amount of time. And that's why dilution is so important. With that being said, I ask you to check with your healthcare provider and talk about the use of oxymetazoline, especially if you are working with an ear, nose, and throat doctor or an allergist. Each one has their own preference, and people in the medical space have opinions on the use of oxymetazoline. I've been using it for years, and I actually learned this trick from my allergist many, many years ago. So I use Afrin when I have nasal congestion that's not getting better. So this is how I use it. Once I have a dilute package of oxymetazoline, I test my nostrils. So I will block one nostril and try to breathe in the other. That sounds pretty clear. Then I do it on the other side. Today I'm pretty clear, but oftentimes you're going to find that one side and sometimes both sides are really congested. I use one delicate squeeze to the side that's congested. If both sides are congested, then I squeeze on both sides. I wait 15 minutes to let it really work. Afrin works pretty quickly. We want to give this diluted version sufficient time to work. And then I follow up with a saline rinse. Now my nasal passages are prepped for even stronger medication if I choose to use it. And there's two categories that I'm going to talk about now. The first is nasal steroids. The most common nasal steroid that is found over the counter is called fluticasone. It's the active ingredient in Nasacort, and it's the active ingredient in Flonase. I use the Nasacort design. I'm going to pop the lid off because the nose tip is pretty long, and that means it gets higher up in my nasal passages. There are other nasal steroids available by prescription. Those can also be in a nasal pump, but we also have something called budesonide. I'm holding up a foil packet of budesonide. They're a liquid that comes in an ampule, and some doctors will prescribe this to be added to your saline neti pot rinse. So that's a stronger steroid to help reduce inflammation. And that's what steroids do. Their purpose is to reduce inflammation. This helps strengthen that cell membrane and also will thin that mucus. So again, we're hitting those two big strengths of our nasal passages, those defense mechanisms. Steroids have their downsides, and they are not to be used for a long time when they're taken systemically. So that means oral pills like prednisone. There can be really significant side effects to it. So in order to harness the power of steroids without the risk of side effects, or at least not as high risk of the side effects, you can use these medications locally. That's true of the Afrin or oxymetazoline spray, and that's also true of nasal steroids. If this has been helpful or interesting to you, sign up for my free newsletter where I send you really helpful information in a format that you can understand. This is brain fog friendly advice and medical tips for how to navigate long COVID and other complex illnesses. The links are in the show notes. Nasal steroids work best when they're used consistently. For seasonal allergies, if you want to use them to reduce your symptoms, start using it 2 weeks before the season starts. But that being said, Nasacort and fluticasone, the active ingredient, can be used kind of as a rescue to help reduce inflammation in your nose. When I'm using it when I'm sick, I'll use it twice a day. And then when I start feeling better, I'll drop back down to once a day. I do it in the evenings, but you can do it any time of day that you like. Lastly, I want to talk about antihistamines sprays. And the most common one is azelastine. Azelastine has been in the news lately because there was a recent research study published demonstrating that people who used azelastine regularly had a lower incidence of contracting COVID-19. Whether that pans out to be definitive is yet to be seen, but I've really liked azelastine myself as somebody who suffered with allergies for a really long time because it is almost guaranteed to stop an allergy attack, at least a runny nose for me. If you have long COVID, you may have developed something called mast cell activation syndrome, which is essentially a hyperallergic response. You might be allergic to new things that never bothered you before. For me, I became sensitive to foods, and I had a hard time accepting that certain foods would actually cause allergy symptoms as if I was outside in pollen. I had itchy eyes and runny nose whenever I would eat particular things, and I still do. So that's when azelastine comes in a pinch, and I do use it pretty regularly. What the downside is to azelastine is that it tastes terrible, okay? But there is a way around it, and it's going to taste terrible if you use it the wrong way. I want to demonstrate how to use it the right way. So azelastine has, at least the packaging that I have, has a really nice long, tip to go up your nose. And that's really nice because it goes higher up in your nasal passages. But what you've got to do is block one side of your nose, and you can use this technique on all of these nasal medications. You block one side of your nose, and the trick is to put your head down. Drop your chin, do nose to toes, and then put the tip up your nose that's open. Keep your nose down when you press the plunger. The medicine's going to go up your nose. And as it does, I want you to avoid doing a power sniff. That is sort of our instinct, and that's where you're going to run into trouble. So head down, and after you hit the plunger, soft sniffs. My allergist calls them bunny sniffs, or other allergists just recommend breathing normally. Both of these techniques, keeping your head down and not sniffing really strongly, is going to keep the medication in your nasal passages and prevent it from going down your throat and into your mouth where you taste it. You're not going to be able to use this medicine unless you follow these techniques. It tastes pretty bad, but once you do it the right way, it's like a game changer. Now I'll explain my 3-step nasal hygiene routine. I start with diluted oxymetazoline, 1 sniff to the side that is congested. I wait 15 minutes, follow up with saline, either in a neti pot or a mister. After that's washed out, I blow my nose, clear things out, and after a few minutes, I follow up with nasal steroid. When I need it, I can also either replace or add azelastine. These things together, they don't sound fun, but they are really effective. This is a simple and well-known way to reduce inflammation in a place that is super important in your body when it comes to your immune system. We often forget about how strong our nasal passage is and how big of a role they play in our health, in maintaining our health. So I hope that this was helpful and that you start using some of these. Let me know if you're a neti pot user like I am, or if you've ever tried these other ones. Thanks for watching Long COVID MD. Subscribe, like, hit the bell so that you get notifications of every episode. Subscribe to the newsletter. It's free and super informative. I hope you're feeling well today, and take good care. Bye for now.